When you go to a hospital to implement this model, how do you connect with them? And then how do you go about providing them those resources that they are needing to be able to easily implement this or even accept this change?
How I connect with them is variable. It can be because someone saw me at a conference or oftentimes podcast listeners. So sometimes it's bedside clinicians hearing this, being
Mm,
moved by it, being haunted by it, unfortunately, and saying, I've got to change this. Then we go through this whole process of let's get your data together. Let's show your executive leadership team where you're losing money, financial and legal liabilities of this, so that they're willing to support these kind of changes because teams need support, not
yes.
just my services, but equipment, sometimes
Yeah.
staffing. I've been able to get extra nurses or extra mobility techs. We have to go through that whole process of getting clinical leadership buy-in. Once my services are secured, then I start to meet with leadership of each discipline. So rehab, respiratory, medical, nursing, and talking about what their role is going to be. Then we do webinars and I customize them for their team's needs, their patient population. And we talk in depth about the why, about delirium, about ICU
Mhm.
cord weakness, about what is an awake and walking ICU. And I come on site with a team because
Mm.
it takes a team. So I bring a respiratory therapist with me and a physical or occupational therapist because the team needs to see me work with the team. And we come on site and we participate in rounds. We weigh in on
Mhm.
their plan of care for their current patients. We all stand at the doorway and help coach them through implementing
Mhm.
these principles to their own patients. And we also do simulation training. So we can really work through what's everyone's roles. How are we going to do this? They practice critical thinking with, quote, real patients. Someone's in
Yeah.
the bed pretending to be the patient. Also, we're doing a gap analysis. We figure out what else do they need? What do they need to work on? What are the next goals for the next month? And then I meet back with them virtually next month and the next month and for 6 months to 6 to 12 months after to make sure that
Wow.
they're meeting their goals and they're progressing.